Congratulations on the birth of your baby. This resource is to support you after finding out your baby has a sickle cell condition.
What is sickle cell? Sickle cell is a genetic condition passed down from mom and dad.
It's lifelong, but with the support of your medical team, your child should have a full, active, long, and happy life.
Sickle cell affects hemoglobin in the blood, a protein responsible for carrying oxygen around the body, and can cause red blood cells to become sickle-shaped.
This means they cannot pass through blood vessels easily.
At 1 month of age, you will have been told your baby has sickle cell. You will have been told how to reduce the risk of sickle cell crisis. For example, keep your baby warm and well hydrated.
Keep a thermometer at home to monitor your baby's temperature if you are concerned. If their temperature is above 38 degrees, take them to the emergency department.
Lots of parents find the time around their child's diagnosis hard. You aren't alone.
Discuss how you are feeling with a healthcare professional. They are there to help.
At 2 to 4 months of age, make sure your baby has their routine vaccinations to prevent serious infections and reduce the risk of sickle cell crisis.
Your baby may develop a slight temperature or seem a little unwell after their vaccinations. You can give them paracetamol as directed by the healthcare professional.
If their temperature is above 38 degrees, take them to the emergency department.
Your baby will need to start having antibiotics, for example, penicillin. This is because babies with sickle cell are at much higher risk of serious infection. Make sure you give your baby the antibiotics as instructed by your sickle cell team.
You may be shown how to fill your baby's spleen by your sickle cell team. At 6 to 12 months of age, you will have further appointments with the sickle cell team when your baby is around 6, 9, and 12 months of age. The amount of fetal hemoglobin drops, putting your baby at greater risk of sickle cell crisis.
Signs of sickle cell crisis in babies include pain, fever, swelling of the fingers, hands, toes, and/or feet, called dactylitis. Your sickle cell team may discuss the use of a drug called hydroxycarbamide, also known as hydroxyurea, with you. This can reduce the frequency and severity of sickle cell complications, including painful crises. Your baby will need more vaccinations between 6 to 12 months of age.
Checklist. Make sure your baby has had their vaccinations at 8, 12, 16 weeks and 1 year.
Give your baby the antibiotics as directed by your sickle cell team.
Your sickle cell team, GP, and health visitor are there for help and advice.
For further support, visit the Sickle Cell Society webpage.